If you're an aspiring psychologist in Singapore, here's a book review of Clinical Psychology in Singapore, an Asian case book. So disclaimer, I'm not a psychologist and have no training in the field of psychology. It's just a personal interest of mine. Now, the book starts off with an introduction to clinical psychology in Singapore and is followed by 20 case studies split into 3 demographic categories of child and family, adults, and older adults. Do keep in mind that this book was published in 2015, so the info is close to a decade old. But here are some interesting facts from the book. Fact 1. James Cook University was the first university to offer postgrad psych programs in Singapore starting in 2004. Fact number 2. NUS started offering 2 postgrad psych programs in 2008. The first was an NUS only program, and the second was a joint degree program with the University of Melbourne. Fact number 3. Male candidates made up only 17.5% of the enrolled cohort at NUS between 2008 and 2014. Now, moving on to the case studies. They follow a consistent format, starting with an intro, moving on to a background, assessment, diagnosis, integrative formulation, treatment, discussion, and ends off with some discussion questions. One of the new things I learned was the 5Ps formulation framework that was used in the integration formulation part of every chapter. I did some additional reading on my own on this and discovered that it's a formulation framework utilizing 5 factors developed by McNeil et al., in which they conceptualize a way to look at clients and their problems systematically and holistically, taking in consideration the presenting problem, predisposing factors, precipitating factors, perpetuating factors, and protective factors. If you'd like to find out more, the paper is open access and titled "Is Diagnosis Enough to Guide Interventions in Mental Health?" using case formulation in clinical practice. I won't comment too much on the cases as I am not qualified to do so. But I found Chapter 4's case on anxiety and autism spectrum disorder interesting, as it highlighted how the intervention didn't just include the child diagnosed with ASD, but also involved providing psychoeducation on ASD with the parents. Chapter 18 was also interesting to me. It was about the neuropsychological assessment of financial decision making. The case involved an 88-year-old chairman of a large family business who initiated legal action against one of his daughters for trying to acquire a controlling interest in the family business. And his psychologist was brought in to assess his mental capacity and financial decision making abilities. So it kind of highlighted how clinical psychology comes into play even in the legal aspect. Anyway, from a layperson's point of view, I felt that the book provided a great introduction to clinical psychology, and the examples and structured format really helped me digest and understand better. I would recommend reading this book with the caveat that the book is old and there might be changes to the science, as well as the landscape of clinical psychology in Singapore. Okay, thanks for watching till the end of the video. If you found value in this content, please help me out by liking the video. And if you haven't, please subscribe to the channel and turn on the notifications as well.